Welcome to Vitamin OC. I'm Joanna Weiss.
And I'm Whitney Gomez. Every week we bring you your recommended dose of civics and civilization in Orange County. And today we are thrilled to have with us pediatrician Dr. Eric Ball. Thank you for being here.
Thanks for having me.
Dr. Ball has been practicing locally for over 20 years, and he is a local, state, and national medical leader. And we have so many things that we want to talk to you about today. He serves on the board of directors of the National American Academy of Pediatrics and helps guide national policies and lead legislation on issues related to child health, vaccinations, Medicaid, and health for immigrant children, which is a very big deal. And, I don't want to play down all of your other accomplishments, but you did grow up in New Jersey, and we have that in common. So congratulations on that. You are also married to one of the most effervescently positive people I've ever met in my life. I don't have to tell you that. And you have two wonderful children. One just starred in her high school musical. She was terrific. And your son is studying abroad in Germany.
Exactly.
So you have a lot going on.
A lot going on.
Well, we're so thrilled to have you. And I will continue with some of your accolades and your accomplishments. Dr. Ball is also the chair of the American Academy of Pediatrics of California. In this role, he advocates in Sacramento on issues such as e-bike safety and regulation, tobacco regulation, and protecting vaccine access for Californians. You work on education and workforce issues for over 6,000 pediatricians in California. You're on the board of the Orange County Medical Association and will start as the secretary-treasurer of that organization next month. You're on the board of the California Immunization Coalition and have co-chaired a task force on increasing vaccination access rates throughout the state, throughout all of California. You attended Duke for college, no schlep of a school there, UNC Chapel Hill for medical school, and you were chief resident when you did your pediatrics training at Stanford. So impressive.
Very impressive. There's so much to say about you. I think we'll link your bio in the show notes if people want to read more about you. But we do have some breaking news. I don't think it's been formally announced, but you've been recently named the Orange County Medical Association's Physician of the Year, not Pediatrician of the Year, but Physician of the Year, which is very exciting.
Congratulations.
I think there's an upcoming celebration for that. So
thank you so much. Thank you. We'll have an event next month for it. I'm really honored to have that.
That's huge. Well, clearly well-deserved. So congratulations.
So in reading your biography, we can tell how many health-related organizations that you've been involved in leading. Can you walk us through how medical policy decisions are made, particularly at the state and the local level?
Yeah, I'll take a step back and talk about how I got into all of this. And I think most pediatricians, most doctors who are interested in policy and interested in advocacy have some sort of origin story. So my origin story was that my practice in Southern Orange County was kind of at the epicenter of the Disneyland measles epidemic in 2014, 2015. So we had several cases in my office. I took care of a few kids with measles. I saw them suffering. And this was happening because our vaccination rates in that area and in Orange County were actually quite low at the time, well below the rate where you would not see diseases spread. And so we started seeing these diseases that were previously eliminated in the country in our communities, in my community in Southern Orange County. And I knew that I could advocate for children one-on-one in the office in front of families, but it was much better for me to do this on a grander level. So do it at the State House, do it nationally. And that got me involved with our local American Academy of Pediatrics, which got me up to Sacramento, lobbying, helped part of a large team that helped to pass strengthened vaccine laws in California, which fortunately has kept our state much safer than some of the other states in the country with current measles outbreak and all the vaccine-preventable diseases that we are seeing exploding throughout the country. I've had the privilege of being able to advocate for children and for pediatricians in Sacramento and in Washington. And personally, I find that as a doctor, this is what we're supposed to do. My goal is to keep people healthy, not only one-on-one individually with my patients, but also to keep my community healthy. And I found that statewide and national advocacy is the best way to get that done.
That's amazing. Can you talk a little bit about how the policy decisions get made and where you decide to get involved? And
on a state level and then on a national level, we have essentially committees that work to go through all the legislation. In California this year, we looked at over 2,000 bills that had been introduced. Of that, we distilled down a few hundred that were related to healthcare issues or issues related to children. Of that, we have a committee through the state of pediatricians that looked at several dozen that we actually weighed in on. And by weighing in on them, some of them were just writing letters, supporting bills, opposing bills. A lot of them were up in Sacramento, having conversations with legislators, testifying in hearings, and really pushing legislation. California, we're fortunate that we don't have a lot of the issues that some other states are having currently. So the things that we've been focusing on in California, which has been especially pertinent to those of us in Orange County, is we're really focusing on e-bike safety right now. There's a tremendous number of horrible stories, especially locally, of children being injured or killed on e-bikes, which are essentially motorcycles that kids are riding 30 miles per hour down sidewalks. So we're working on e-bike legislation up there in Sacramento right now. We're also working to strengthen our vaccine laws, again, as a bulwark to prevent what we're seeing throughout the country happening in California as well. So that's what we do on a state level. Nationally, you take that and then you just amplify it to a much greater level.
And can you talk a little bit about how political medical decisions are made? For example, if the state wants to see meaningful changes in health policy, if the governorship changes political parties, what kind of impact would we see on, say, your state mandated vaccine work?
So we're nonpartisan. We will work with anyone. We think healthcare should not be a partisan issue. We think vaccines should obviously not be a partisan issue. Unfortunately, I think some of it has become quite partisan. And, from a political standpoint, sometimes you have to tailor the message a little differently depending on who you're speaking to. For example, one of the things that we've been talking about vaccines recently is they're good for the economy. They're good for not only keeping our kids healthy, but I'll give you an example. There was a measles case at our local children's hospital about a year ago. One kid went into the emergency room once with a case of measles, exposed hundreds of people in that emergency room. One of my colleagues did an analysis of the cost of that one exposure of one child in one visit in the emergency room. It was over $100,000 to the hospital. And that is on contact tracing, so trying to figure out who was exposed. There were several nurses who were pregnant who needed to be out of work for a few weeks for fear that their unborn children would get measles. So there was a lot of costs involved with this. So vaccination not only keeps our communities healthy, but it's quite cost effective. And not just that, when you see these vaccine preventable diseases spread through a community, it strikes fear, it slows things down. When we were having our measles outbreak in the Disneyland measles outbreak, we had many kids who could not go to school. We had people who wouldn't go to the grocery store. If you had a child, or an adult for that matter, who was immunocompromised, who had cancer, who had a transplant, or you had a baby, like that shuts down your economy. And so we have to focus our message on not only it's the right thing to do to keep things healthy, it's the right thing to do to keep our communities healthy, but also it's good for our economy, it's good for our country.
And can you talk, when you're talking about, I think the bulwark of using California as establishing some of those parameters and guidelines for the rest of the country, we've seen a difference in state by state regarding ability to access certain types of healthcare, like reproductive care, abortion care. Are there other types of healthcare that are being balkanized that way, where there are state by state decisions that are maybe overriding some federal concerns?
Yeah, not only that, but we're seeing people move. We've had a huge influx of, for example, OBGYNs from like Idaho who have moved away because they can't practice medicine properly there. And so they leave. Right now, we are in the midst of a grand experiment in the United States with vaccinations, where we will have certain states where kids will be under-vaccinated or not have access to vaccines. And certain states like California will kind of go on business as usual, vaccinating kids. We're not only seeing it state by state, but we're unfortunately going to start seeing it, I think, child by child, related to essentially your resources. So about 50% of children in the United States get their vaccines through a program called Vaccines for Children program, which is free vaccines that are provided by the federal government, which go to states, which we then use to vaccinate these children. Those vaccines are based on federal guidelines. If federal guidelines change, children who are on Medicaid, who don't have commercial insurance, they will not be able to get those vaccines. So if federal guidelines say take away like a hepatitis B vaccine for children, then anyone who receives their vaccines in a Vaccines for Children program, so children on Medicaid, they won't have access to those vaccines. My children who have commercial insurance, they will. So now we potentially have a country where we're having poor kids not getting vaccinated and kids who have more resources getting vaccinated, which frankly is super scary.
Yeah, that's awful. It reminds me a little bit about our conversation with Planned Parenthood, where because of the reproductive choice issues. People are having to come to California for abortion care, reproductive care. Have you seen any transportation or people transiting to California in order to get access to vaccines? They might not be able to.
Unfortunately, I've seen both, right? So I've had families who have left California. They moved to Texas or Tennessee because of our vaccine laws, and they want their children to be able to go to school. And you can't in California if you're unvaccinated. Conversely, I've had new patients come here from Florida, Texas, and those sort of places because they're afraid of living in a community where that's greatly undervaccinated.
Right. And on the national level, what kind of issues are taking up your time these days?
Oh, so much. There's a lot going on. Vaccines is a huge issue right now, not only with access, but just with the tinkering of the way that we provide vaccines, the way we decide who makes vaccine recommendations. Right now, we have a lot of concerns about immigrant children and making sure that we treat people humanely and we treat children like children. It doesn't matter where they're from. So we're working on issues with that as well. And then a huge issue that we've been working on for 2 years now is trying to keep Medicaid safe. So about 50% of children in the United States receive their health care from Medicaid. So when you cut Medicaid, you're cutting healthcare to children, and that trickles down. Our children's hospital, about 60 or 70% of their patients are on Medicaid. So if you cut Medicaid, that's putting at risk our entire healthcare infrastructure. If we can't have Medicaid patients at our children's hospital, then that children's hospital is going to close. And then my kids who aren't on Medicaid, they won't have anywhere to go either. So there's a whole lot of issues. There's a lot of headwinds right now, and we're just trying to make sure we can keep kids safe and healthy.
Going back to the vaccine issue, it's no surprise to anyone that they have become highly politicized, particularly post-COVID. Can you take us, HIPAA compliant, into an exam room with a family that doesn't want to vaccinate their children? What is that conversation like for you?
Yeah, it's hard. It's really hard to be a parent right now. There's a lot of very confusing information out there. You're bombarded on social media with conflicting messages, and frankly, you don't know who to trust. So, I mean, I feel privileged that in my position as a pediatrician, I'm hopefully a trusted source of information. So I hope that the families will come to me and have those conversations. And usually we sit down and, they say, I'm concerned about this, that, or the other thing. And I'll ask, well, what have you heard? Let's talk about it. Let me explain why I vaccinated my kids at all the right times. And we'll try to debunk some things. But I think the biggest thing is just listening to people, kind of figuring out what their concerns are, reassuring them. I think whenever I go to a doctor, I think the number one question I always have is, well, what would you do?
Exactly.
What did you do with your children? So I'm very open about, I show my patients my kids' vaccine records. I'll be like, look, my kid had a flu shot this year. Here's the date. Here's when it happened. So I think that's something I could do to reassure them. But it's hard. I just feel really bad for a lot of the families out there. It's definitely more difficult raising a child now than it was even when I was, had babies who were getting vaccinated.
So I can understand the myths and disinformation on the patient side, but can you also take us into the conference rooms where you're speaking with other physicians who may be anti-vaccination? What are those conversations like?
They're really few and far between.
Okay.
Yeah, it's 99% of physicians, I think, follow science and know what's best for families.
That's reassuring.
Yeah, that's really reassuring.
Mm-hmm. The people who do not, they're just loud. They're even with vaccines, right? So in California, over 95% of children are fully vaccinated. So the vast majority of families, they choose to vaccinate their kids. The vast majority of them choose to vaccinate their kids at the right time on the correct schedules. It's just the small group of people that don't. They're very loud. I don't post on Instagram my kid got his MMR vaccine today and everything was cool. We don't do that. But I think a lot of the people who are on the other side are just very vocal about it. And so you get this feeling like it's a 50-50 thing. But the truth is the vast majority of Americans believe in science, believe in vaccines, trust their pediatricians, trust the American Academy of Pediatrics. And I think we just need to be a little more vocal about it. And we need to be out there a lot more. And it's to our detriment if we're not on TikTok and Instagram and in the spaces where our families are, because I can talk, again, like we talked about advocacy, I could talk to families one-on-one in my office, and that's helpful. But we need to get to where the families are getting that information, and they're getting it on social media. And right now, that infrastructure is being flooded by people with conflicting, confusing, not accurate information.
Okay.
And speaking of that, there's a lot of disagreement among the non-experts. It sounds like maybe the 99% of doctors are aligned in their beliefs. But when people are trying to do their own research and maybe they don't have as trusted a pediatrician as you are for your patients, and they want to look into making some of these decisions on their own, are there some trusted resources that you would suggest people go to?
Well, I'm biased, and I'm on the board of the American Academy of Pediatrics. We have an amazing patient-facing website called healthychildren.org, and I would encourage people to go to that. It has a lot of really good information that's scientifically based. We have a patient-facing podcast also from healthychildren.org, and I think that's quite good medical information as well. So I would start there. Actually, on the American Academy of Pediatrics website and on healthychildren.org, we have a list of social media influencers who will provide accurate information. These are generally pediatricians who will give accurate medical information. So I would start there. And then I think the definitive thing is most of us have a trusted, I hope, have a trusted physician. I think most of us have a pediatrician, someone who they can go to. I want to spend that time with my families. I want them to come to me when they have those questions. So don't feel guilty about having these conversations with your pediatrician. That's what we're there for. And so, ask us.
During COVID, all of us learned, if we didn't know before, about herd immunity.
Yeah.
Can you remind us of herd immunity? And you mentioned that most of California is vaccinated. So do we have any herd immunity issues here in Southern California?
We're better than most other states. Luckily, we have very strong vaccine laws, so most of us are well vaccinated. The point of this kind of immunity is there is a rather large subset of the population that cannot be immunized or that they're immunocompromised in some way. So I think about people who have autoimmune diseases and are on medications that lower your immune system. We have kids with cancer. We have kids who have transplants. And probably most pressingly, we have a lot of babies who are too young to be vaccinated. When we had our measles outbreak in 2014, 2015, we had a lot of babies exposed in waiting rooms and emergency departments who were there for a checkup or because they had a rash and they got exposed to measles in the waiting room. So there's a huge percentage of the population that actually cannot be vaccinated. And so we rely on everyone else getting vaccinated to protect them. And that's kind of, was the message during COVID. We're doing well here. The issue is unvaccinated people tend to cluster. So if you look at the vaccine rate in California, we're at 95%. It's not evenly distributed. So it tends to cluster. So there was a huge outbreak in Texas recently, and it started amongst the small religious community who were largely unvaccinated. So it wasn't an evenly distributed group. And that's what we worry about is, so if you're unvaccinated, you tend to hang out with people who are like-minded to you. So you're hanging out with other unvaccinated kids. And that's why we start seeing these diseases spread.
When I was growing up, measles was like some olden days thing that you just knew you didn't want to get. I didn't know any of the details of it. But I recently read an op-ed in the New York Times where this mother described her child actually contracting and suffering from measles, which was heart-wrenching to read. And I'll link the article in our show notes. Will you tell us what measles is, what it presents as, and what one experiences when they have measles?
Yeah, I'd never seen measles before the Disneyland outbreak, and then I saw a few kids. I was surprised how sick they were. It's a viral illness. You get high fevers and this strange rash that someone described as you dumping a bucket of red paint over your head. So it's this rash that starts on the top of the head and kind of descends down, and then bad cold symptoms and what have you. But the danger with measles is there's a high complication rate. So a lot of kids get pneumonia. A lot of kids get, not a lot, but you can get brain swelling, inflammation. About one in 1,000 kids who get measles will die from it. The article you're alluding to, that child died about 10 years after she had measles from something called subacute sclerosing panencephalitis, which is basically this horrific thing that's a complication of measles that happens a decade or more after your case, where basically you have brain inflammation. We actually had a child at Children's Hospital of Orange County who died of subacute sclerosing panencephalitis this year, who had immigrated here from another country where measles was more common, had measles as a baby, and this kid was, 12 or something, and died. So we see this. The other thing that happens with measles, which we were seeing after the measles epidemic, is for some reason, the virus basically causes your immune system to like lose all of its memory. So one of the interesting things about the immune system is like, as a kid, your immune system is kind of naive. You haven't seen any viruses. So every virus you get, you start to get immunity to it, which is like why your kids get hand, foot, and mouth all the time, but you don't because you had it when you were like 5. Measles like erases all that. So we were seeing these kids who had measles, and then they were coming in with all these weird like baby diseases and childhood diseases that they were getting again because they didn't have immunity to it anymore. So it's not just the disease that you get up front, but it's all the complications that could happen down the road that are super scary. Finally, I'd say about measles. Measles is like the most contagious, one of the most contagious viruses we know. It's kind of the canary in a coal mine. So when we start seeing lots of cases of measles in the United States, we know that we're going to start seeing other things. And I would not be surprised. We're seeing more cases of whooping cough. We're seeing more cases of other vaccine-preventable diseases. And I think measles is just the beginning, unfortunately.
So shifting to adults and diseases that we get from being unvaccinated, I would tell a quick story. When I was about 30, had just had 31, had just had our second child. My husband's family's from New York, not New Jersey like you cool kids, but from New York. And so we were going back to visit his family. I had twins that were 2, and then a newborn who was maybe 6 months old, and planning this trip to New York to go see his family for the first time with all these children in tow as a new mom of 3. And I think I got so worked up about it, I got shingles. And that's one of those diseases. It was a little bit hard to have the doctor even identify what I had, because at 30, I was not a typical patient for it. And I had chickenpox before, so I don't know if that provided any natural immunity. I think it should have, from what I understand. And so it was very painful. It was not very fun. Wound up healing enough to be able to make that very stressful trip with the kids that I think caused my shingles, because I think I was a little immune compromised by stress. And now as a mid-50s woman, I'm thinking about getting the shingles vaccine. I think that's doctor recommend. Can you talk a little bit about the shingles vaccine, whether you think it's recommended for our ages, and if there are any extra benefits from getting the vaccine?
Yeah, so you're exactly right. So shingles is a reactivation of chickenpox. So you get chickenpox as a kid. You don't kill the virus. The virus like lives inside of you and gets kind of walled off by your immune system. It lives like actually in your nerves. And if your immune system goes down, right, because you're stressed or sleep deprived because you just had twins, or you get older, then the virus could escape and it causes shingles. And it's supposedly incredibly painful. And actually, I've heard of cases of older people it's been a cause of suicide because they're in this chronic pain condition. So yeah, so at age 50, you're supposed to get I just turned 50, so I've got to get I'll get my shingles vaccine. It basically reminds your immune system that, hey, remember this chickenpox virus? Like, keep this in mind. This is bad. So it keeps it kind of in tow. Interestingly, there's been some data that have shown that it might be somewhat protective against like Alzheimer's disease and dementia, getting the shingles vaccine. So I think some of that data is still evolving, but it's just interesting to see that like some of these things are protective outside of just, keeping you healthy from making you not get sick with the virus.
Good to know. Good to know.
Yeah,
Thank you.
Very good to know. You mentioned California's laws on school vaccinations, and you seem to think they're strong enough. Are you pretty happy with where things are in this state on that front right now?
I do. I do. The issue we have in California is our school vaccination laws are quite strong. So we have universal transitional kindergarten. And so to go to TK when you're 4, you need to be fully vaccinated. Most Californians, by the time they turn 4 or 5, are fully vaccinated, like over 95%, which is fantastic. The issue we're having in California is that our rates are much lower for, say, 2-year-olds or 3-year-olds. So we have some families in California who are delaying vaccines until they get to school age. And that is setting up, as we talked about before, like little clusters of unvaccinated toddlers who potentially are getting sick. We just had a huge measles outbreak in South Carolina. Over 1,000 kids got measles in South Carolina. Almost all of them, 97%, were unvaccinated, and the vast majority were young unvaccinated children. So I feel secure about our school age population, but I still do worry that we have this kind of hidden group of unvaccinated small kids who are the most vulnerable to getting quite sick with these diseases. And I'm on a task force with the state to try to focus on those kids. And a lot of the kids who are unvaccinated, it's not just because their families are hesitant or, had, read something online. Actually, a lot of it is access issues. There's a lot of people who don't have health insurance. There's a lot of people who don't have doctors. There's a lot of people who don't have access to transportation or other things that get you to be vaccinated. So they want their kids to be vaccinated, but they just don't have access. So in California, we're trying to work on finding these pockets of unvaccinated kids, trying to figure out how we get them better access to vaccines and making sure we get them protected.
It's complicated. It's so much more complicated than it appears to be at first blush.
Yeah, we live in suburban Orange County, we have resources. So for me to go to take my children to a checkup, it's fine. But, for a family who's, a single mom of 3 kids and she has 2 jobs and she doesn't have a car and needs to take a bus to get her babies to, a clinic, that's hard. And it's very understandable why that child would miss a few checkups and might fall behind on their vaccines. So we're trying to figure that out as well. I personally think that that's an even bigger issue than hesitancy and misinformation. It's just like access and just healthcare accessibility in our state.
Okay.
Which is a huge problem. Actually, we should do another podcast on that. Again, speaking with Planned Parenthood, talk about access to reproductive health care and medical care for women. But I think child access is not talked about nearly as much, I think, as women's health issues are, but they're very impactful for our society. We talked a little bit before about people doing their own research. And can you talk about a little bit about what you think are some of the biggest misconceptions in public health or regarding vaccines right now?
There's a lot of misconceptions in public health regarding vaccines. The biggest one is there are almost no downsides to getting vaccinated. Side effects, risks of vaccines are in the 1 in thousands, 1 in millions. The benefits of vaccines are immeasurable. One of the issues we have currently is that vaccines are a victim of their own success. So most people have never seen a child with measles or seen a child with whooping cough or meningitis or these things. I have a different perspective. I've seen kids die of whooping cough. I've seen kids on ventilators for weeks because they got tetanus, or I've seen children lose limbs and die from meningococcal meningitis. So unfortunately, we end up seeing these cycles with vaccinations where the vaccines work, the diseases go away, kids don't get sick, people get complacent, so they stop vaccinating, and then the diseases come back. And when the diseases come back, then people start vaccinating again. We saw vaccine rates against measles go way up in Orange County after the Disneyland outbreak because now measles was a real thing. It was in our community. We wanted to protect our kids. And so I think we're in another one of these cycles. Unfortunately, kids suffer and die because of these cycles. And I think it's important to make sure we do a better job communicating with families about how dangerous these diseases really are, that they are real, and that we need to protect our kids from them.
Not to get too political about it, but it must be difficult doing the work of the Academy of Pediatrics when you have national figures at the top of the political ladders spouting misinformation. That can't be easy.
We rely on federal agencies to set standards and to have good practices and to follow science. I mean, for decades, the American Academy of Pediatrics puts forth a vaccine schedule I think we've done it for like 70 or 80 years now. And for the last 40 years, the AAP works with the CDC and they put out the same schedule. This is the first year this year where the AAP has a different vaccine schedule than the CDC. And that's hard for us. These are our partners and our friends and people we work with. And there's amazing people at the CDC. And we want to make sure that we are able to put out the best science regardless of what's coming down from the federal government. And we want to make sure that we keep our kids healthy and follow guidelines and follow science. And, science, diseases, these will always be there. Administrations will come and go. We'll have to rebuild these institutions when things turn over. But it's tough. And, unfortunately, we're going to start seeing bad things in this country with regards to healthcare. We are seeing bad things with regards to healthcare because of some of these changes. So we want to make sure that we're doing the best we can until we can make things better.
We want to close with some free medical advice, if you don't mind.
Of course.
For people in their 40s and 50s. You mentioned your daughter received the flu shot. Do you recommend that all adults get an annual flu shot?
Yeah, there's no reason not to get a flu vaccine. I mean, it's kind of crazy, but of all the things we vaccinate for, it's the thing most likely to kill you. And, this year, I was talking to a friend recently about children. Every year, a few hundred kids in the United States die of influenza. Almost all of them are unvaccinated. What's important to remember about flu vaccines and COVID vaccines, for that matter, is the purpose of them isn't to make you not get the flu. Lots of people get a flu vaccine, still get the flu. Lots of people get a COVID vaccine, still get COVID. It's to make it so if you get those diseases, you don't end up in the hospital. You don't end up dying. A big study just came out about COVID vaccines, which showed a 53% reduction in hospitalization for older people who got a COVID vaccine versus those who didn't. That's why we give it. And, when I'm in my office, if you walk in the room and a kid has influenza, you can tell whether they had the vaccine or not, because the ones who haven't, they look worse, they suffer longer. And the ones who did, they bounce back a lot faster. So I'll always get a flu vaccine. My kids will always get a flu vaccine. It's a smart thing to do.
And how about the COVID vaccine? Is that a more age-dependent thing? Or?
Yeah, same. I think the COVID vaccine is a little more nuanced, and I think taking kind of a risk-based approach is probably a better way to look at it. If you're a healthy 10-year-old child who's had COVID 4 times in your life and has had a bunch of COVID vaccines, like if you get COVID, you're probably not going to end up in the hospital. If you're 65 or 70, like it's a pretty high risk disease at that age. I get a COVID vaccine every year. I feel it's part of my responsibility as a doctor to keep myself healthy and not to get sick. And anything I could do to keep myself healthy, I'll do. Because if I get COVID, I don't want to spread it to a bunch of babies and other people who I'm seeing in my office. That's part of my responsibility as a physician.
Anything else that we as just human beings or parents on the health front, anything else that you think about in your family that we should be thinking about?
So much.
Diet, exercise, sleep, water.
Exactly.
I mean, as a general parenting, pediatrician thing, my best advice for families is always just to relax. And we stress out about way too many little things, and we don't worry about the big things as much. And there will be days where kids eat a lot and days where kids don't eat very much, but I still haven't seen a kid starve to death or have vitamin deficiencies or things like that. I find that kids who are pressured too much at school, they get stressed out. And I see a lot of kids in my office, teenagers with anxiety and those sort of things. And probably the best advice I could have is if there's something that you think might be bad for your kid, hold off as long as you possibly can before they're going to be exposed to it, right? So don't get your 12-year-old a phone. Don't let your 10-year-old go on social media. They will learn about these things. But once you kind of open those doors, it's really hard to close them. And sometimes you have to be the bad guy and you have to say, I know that Johnny down the street just got a phone, but you're 8 years old. That's not appropriate for you. So it's really hard to be a parent right now. There's a lot going on. You're kind of in competition with all these other parents. Your child is spending half their day on Instagram and getting all these messages. We are seeing a disgusting amount of mental health issues in teenagers. It's been really difficult. I think it's hard to be a kid right now. So as long as you can hold that off and let them be kids, I think that's the best for them.
Keep them young as long as possible.
Exactly.
Yeah.
Love that advice. Love that.
Thank you for joining us. I mean, we could talk to you for 2 hours and we know you've got other things to get back to, but your work is really making such a difference in our local community. The vaccination issue is obviously huge, and you have such primary experience with that you're able to share with your patients and with us. So thank you for coming to talk to us.
Appreciate it. Thanks for having me.
Thank you so much, Dr. Ball. We're so grateful for you. Thanks for persevering in our community to keep us all safe. And thank you for joining us. To our listeners, vaccinate your kids. Get vaccinated yourself.
We'll see you next time on Vitamin OC.